Hi, today we're going to go over the compact album/drive surgical kit, the conventional kit. We have an implant as well as a sawbone, and we'll go over the actual surgical kit itself. So along the top row, optional drill with a spear on the tip here. It's just to get you a starting position within the ridge. Then we have our 2mm twist. It's pretty standard with all systems to start with a 2mm. A 3-5, 4-3, 5-0 drill. These are your drills to just prep your osteotomies. Though we call these a 3-5, 4-3, and 5-0 drill, they're actually undersized 0.7. So then next we have the countersinks, a 3-5, 4-3, 5-0. These are simply to remove some of the bone just at the top of a cortical plate. And then there's also a drill extension. So I want to show everybody quickly that the drill extension can slide any one of our drills in case we need to get between teeth. And in doing so, it has a little set screw on the side. So we need to make sure that we back this thing up lefty-loosey, righty-tighty, get our driver, or our drill in this case, in, turn this thing to the right, and then it locks it up. Okay, so we can't get the drill to fall into the back of the patient's mouth. Okay, I'm going to back this up, put this back in the kit. And everything along this top row is at 800 RPMs. All right, we don't need to exceed that because of our tapered drills. They do the cutting on the sides as well as the tips. It's going to create more friction, so we want to slow our speeds down. Anything we're doing with straight cutting drills, and as if we're using the other system, the Titamax or parallel walds, those could go a little bit higher. But this kit, this top row, you touch any of these items, we're at 800 RPMs. The second row means we need to slow it down. So we have our implant drivers. This driver has the latch type on the end. These two have a square head. This is a short, and there's a long. Anytime I see any of these drivers or instruments with a square head on the back end, that means that they're inserted into the torque wrench. Okay? So when we set up the torque wrench, we want to make sure that we have Neodent facing up. This thing is spring-loaded on the end, our torque wrench, so be careful, that could fall out. I want to make sure when I look at the wrench and set this up that the square portion, the underside, not the round side, but the square side, is always coming up from the bottom. So I'm going to pull this out with my fingers. I'm going to bring this instrument, the adapter, back up. And this way, I can actually attach any of my square heads on this side. Okay, the square attachments to my driver. That being said, I also want to check on the end and make sure that the arrow is facing towards me on the wrench. And then when we're ready to insert, we're only using our thumb and index finger on the end. And I should be able to hear that ratcheting sound. And then only holding on with my thumb and index finger on the end and pulling, I'm met with resistance as I'm inserting my implant, and then I can get a measurement on the side of our torque wrench. Okay? This does nothing. I see a lot of restorative folks that sometimes put their thumb on here and it counteracts against the driver. So, all right, so we're going to put the torque wrench back in, driver back in, and look at our next thing is a bone tap. So these bone taps are meant to prep an osteotomy slightly more if need be, usually on the lower. We're doing this with the album implant only. It matches the threads. And the way that we can connect in our kit is with this guy. It connects to the hex on the top of the bone tap. And now we can attach to our handpiece. This is in that second row. So again, this is where we want to go or change the speed of our drill to the same speed as the implant. It slowly goes in, it threads the bone. We step on our pedal, hit reverse. It'll slowly back this back out. Okay? That's our taps. That's how they work. We not only have for a latch type, but we have two other ones. Again, if I pull these out, they have a square head. That means we can literally do this with the torque wrench by hand. Okay? Parallel pins are in the bottom row here. I love this little tissue measurement gauge, which the restorative dentist uses it well. But it's in our surgical kit in case we're temporizing things, or we can even place this into the top of our implant and get a measurement on the side so that we know which height healing abutment to pull out. If we just bring our tissue up, if it's flapped, then we bring the tissue up around the pin, and we get an accurate measurement for the height of that healing abutment. So last thing is our implant. It's packaged such as this. We go to open this, we peel this off. Out this vial goes into the sterile field. And if we just turn this enough, we can see the implant in there. We'll actually pull the whole implant right out of the sleeve. So the implant has, the packaging has these what I call squeeze triggers. If you squeeze these, it makes the implant anti-rotational. This drill has a dimple on the end. This dimple is meant to go in and grab with a friction fit. That's not seated, not down. This is very important. I jokingly say it's the hardest part of the case, but we put the driver in, we squeeze with our fingers on the side of this so that the implant doesn't rotate, and then we gently push the two together. We get them to marry. Now that's a nice, perfect match to the sides. There's these little lines on the side as well. They're 1 millimeter increments. That's when we're placing the implant. It's ideal if we can get it 1 or 2 millimeters subcrestal. And once we pull this thing out of the package, and we'll pretend it's on a handpiece, then we can insert the implant into the osteotomy and bring this guy down. Okay, and finish it off there, which I'm not going to do now. And then, of course, once we get it in, and let's say we torque out on our handpiece at 40, 50 Newton centimeters, where we set it at, we can simply move in the kit to our other wrench, which does not, or our other driver, I should say, which does not have a dimple on the end. So that a little bit more easily seats down into the implant. And I will take a minute on this guy and show everybody that I'm watching my implant as I advance it. I see that my bar is bending out. I'm just holding here, keeping an eye on both depth and using my wrench. And now, as I start to look on the buckle, I'm watching my lines to keep an eye on my placement. I know I've got primary stability and past 30, and I could certainly load this implant if I want to, but it's countersunk a little bit, which is ideal for placing our healing abutment and then our final abutments down the road. That's our surgical kit. Thanks so much. Reach out to myself or one of your reps if you have any questions. We also have, lastly, 2 different drivers. There's a blue driver and there's a gold driver. The blue driver is meant for cover screws, healing abutments, and even impression copings. This yellow screwdriver is an 09 hex. It's only used for final abutments that are indexed or have a hex on the bottom. And anytime you see this driver, we're only torquing to 15 Newton centimeters. That's the beauty of the cone Morse connection or the Morse taper. Thanks again. Thanks so much.